last year meeting, we presented an exploratory analysis performed on patients who had been treated within the pivotal study of Glofitamab monotherapy. And this analysis was aimed at identifying specific molecular subset of patients and to investigate also their response in relation to their genotype. We also did analyze also the role of ctDNA. Now, concerning the connection or the relation between the genomic alteration and response, one of the most impressive results emerged when we looked at TP53 mutations, because 33% of the patients enrolled in this pivotal study and TP53 mutations, which usually are associated with chemotherapy resistance, and so this per se is a very negative prognostic marker. However, what it emerged with Glofitamab is that 25% of the patients with TP53 mutations were able to achieve a complete response. And in a significant percentage of these patients, this complete response was lasting over time for several months. And in fact, when we looked at the progression-free survival of TP53 patients versus wild-type patients with achieved a complete remission, the survival curve were essentially comparable, showing that even if are bearing TP53 mutations, patients treated with Glofitamab, if they achieve a complete remission, this remission will be long-lasting. As far as ctDNA is concerned, we used ctDNA we detected ctDNA in patients at baseline and correlated this with some clinical parameters. And it came out that higher ctDNA levels at baseline were associated with higher levels of LDH, bulky disease, high IPI score, and Ann Arbor stage. Interestingly, patients with ctDNA levels higher than the median value and shorter PFS compared with patients with ctDNA levels that were lower than the median value. And this is another interesting finding emerging from this exploratory analysis, confirming what has been reported in several other studies, that ctDNA per se, when tested at baseline, may have a prognostic relevance. The other finding we observed, we were looking at ctDNA, was based on the longitudinal assessment of individual patients during therapy with Glofitamab. Patients were in fact analyzed not only at baseline, but the clearance was evaluated over time by looking at ctDNA cycle 3, cycle 6, and then at the end of treatment. And it turned out that the patients who achieved a complete remission had a very fast, very quick, and sustained decrease in ctDNA. This, again, is a biomarker, an important biomarker that can be validated in a larger number of patients, because it seems that if there is a reduction of ctDNA at cycle 3 in reduction at least around 2 log degrees in ctDNA, this is an event associated with achievement of complete remission.